You're listening to the Belmar Bites podcast, brought to you by Belmar Consulting. All right. Hey, everybody. We're back and excited today to have one extra face on the call. Matt, it's always good to see you, but Matt Reed, we are honored to have you on the call today. And it's an exciting time for us as an organization, and we'll get into it, I'm sure, as we navigate this conversation today. But we made an announcement recently about the acquisition of your organization, and so we just felt it would be the most appropriate thing to have you on and talk a little bit about that, and talk about what's going on in our organization and what's happening in our industry with our clients. And so thanks for joining us. And maybe to kick it off, Matt Hui, you know Matt Reed a little better than I do. Why don't you give a kind of an underhand pitch introduction here, and then Matt Reed, you can take it from there.
Well, let's put it this way: it's Matt. The other Matt is the smarter of the two Matts on this recording. So, but no, I've known Matt for I don't know, 8 months, 7-8 months now, and just over that time, as shared in the announcement, just a lot of alignment in terms of the values, in terms of how we view consulting, in terms of how we view serving organizations, and just how the current state of consulting, if you will, there's a lot of room for improvement. So over that time, we've had the opportunity to partner, work on a handful of different things. And maybe with that, consider that a softball intro. Matt, you can probably do a better job at introing there, but do you want to maybe share with our audience a little bit about yourself?
Yeah, no, thanks, Matt. I came into this industry as a client who was going through a big Salesforce project like 15 years ago, and I was on the client side. And I've always been in the technical realm, and I was serving as the project manager on this. And we got to the end of this engagement, or what we thought was the end, and we were disappointed. We weren't where we were supposed to be. We'd spent almost $250 million and just weren't happy. It wasn't right. And while the firm that we were working with claimed to be the nonprofit specialist, those kind of things, they somehow didn't hear us right. It just didn't go the way that it should. And so I began looking back and kind of seeing where things went, and just realized we could do this differently. And so the way 10th Avenue started a little over 8 years ago was out of this desire to see that shift in the consulting industry, and especially not just across the board, but especially in the nonprofit world, because the nonprofit world, as you guys know, is unique. It is a little bit different. There are many commonalities. Actually, there's plenty of things from the for-profit space that the nonprofit sector ought to adopt. But there is a uniqueness in the nonprofit space, and specifically in leadership. And so one of our key things going into 10th Avenue was to bring and marry together leadership and change and culture consulting alongside Salesforce, because one of the things that we realize is that success really is about people, processing, technology. And you remove any one of those three, and your project has a huge risk and a huge hole. And so I think, Matt, as we have talked about Belmar, and over the last 8 months, that was one of the things that connected me to Belmar, was you guys are seeing that same vision and also want to continue to grow your firm to be that nonprofit specialist, be that group that is offering more to your clients. And so for me, that was a big alignment. And I've always seen our small firm as staying small. And as we'll probably talk about, we had been part of something in the health and human services space that needed more than what our small firm could handle, or what we wanted to do alone. And so this acquisition and merger has been really good. And but that's how I came into the space. Like, I was a client too, and realized it could be done different.
Yeah. Well, I appreciate the intro and you taking it across the line there. And there's so many different topics that we can unpack there. But you started with uh, you started talking a little bit about the nonprofit part of the market that we serve. So I guess in your time at 10th Ave, what types of organizations did you all work with, and what were you seeing? Maybe if we just kind of do a little bit of a lay of the land.
Mm. Yeah, so we were primarily in the nonprofit space. A lot of the organizations we served were in a faith-based mission organization and also in the health and human services space. I think those two key verticals were for the majority of the time that we were serving in that space. Those were our key verticals. And so one of the things that we were seeing on all fronts is just the advancement in technology as a whole. And we say that and we're like, of course, well, we're all working on Salesforce, but let's just think about where Salesforce has come in the last 10 years and in the recent few years with nonprofit cloud and the fact with Agentforce and all of these things coming with AI. There's just a really big shift in what's happening. And not only that, but the adoption and realization of all the other tools that can now work alongside of Salesforce to really help these organizations fulfill their mission. And so now we're seeing this um, this willingness to make Salesforce kind of the hub, but really dig into the App Exchange and other places to extend what Salesforce can do. And so I think been a huge change in what Salesforce can do for an organization. We're literally seeing entire organizations run the entire organization off Salesforce. Like
Hmm.
when we think about um, an organization serving children in other countries and a donor being able to receive a video message from another country within hours of it being recorded on an iPad and Salesforce being the central point of contact there, that's a really cool thing. And so those are the kind of projects we were able to be involved with on that side. Um, and sticking with that, just kind of Salesforce and the industry as a whole, I
Hmm.
think we're seeing a shift in the way fundraising happens. When we think about, I can think about this even just a few years ago. One of the key things is, hey, we've got a printed acknowledgement letter, those kind of things. And then on one of our last couple of projects, the printed acknowledgement letter, yes, it happens, but it's way less important. We're communicating with donors differently. We're working with donors, and how they could want to communicate with the organization is different. And so we're seeing a need for Experience Cloud or other tools that help extend the fundraising capabilities of Salesforce. And so, again, I think not only just with AI, but we're at a cusp of something new and different happening with Salesforce and the fundraising space altogether. So I think in the fundraising side, that's a key part of it. And the health and human services is a whole nother part of the conversation.
Yeah, and I'm certain we'll get to that because, like you said, it's a whole. I don't know if can of worms is the right analogy, but it is. There's a lot of. I mean, gosh, I was thinking about it this morning, just how many acronyms have been
Oh
somehow
yeah.
ingrained in my mind, and there just seems to be a growing list. So, but I want to tag Scott in here because Scott, you started the conversation with there were some exciting events that had happened. I guess from your perspective, the joining of forces with Belmar and 10th Avenue Consulting. What are you excited about there, and what do you think this? Uh, yeah, I guess what are you excited about there,
Right.
and what your perspective on that?
Yeah, well, I mean, I think excitement is the right word for this. It's a great opportunity for us as an organization to bring in an organization, bring people in, bring sort of the best ideas that they've got, and bring them together with what we've developed at Belmar over the last 15 years. And Matt, you had shared in your intro uh, over the last 8 months this alignment. I think back to the first time that you and I met, there was, I don't know. I guess most people I would imagine know pretty quick if it's worth having a future conversation with the person they're talking to. And for me, it just felt like it was like, yeah, this could go somewhere just in terms of the relationship. And I mean, I certainly didn't think 8 months later we would be bringing your team into ours, but it's interesting how these things work, and for me, the just this alignment is really exciting. And I mean, Matt, you shared what you've observed in the consulting world, at least in the Salesforce consulting world. There's firms that know how to do it, and there's firms that say they know how to do it. Certainly, the evidence in our due diligence and just in over the last eight months, getting to know you and the clients that you've worked with, you guys have always delivered, and you go that. There's the old saying, you go the extra mile. It's like you go an extra 5 miles whenever needed, just to make sure that that customer is happy. And as we've been working through this transition, it's been pretty cool to see uh, the commitment that your clients have had to you. And so, kudos to you and to your team for just really living that and delivering with success for your customers. And it's I'm interested to just understand a little bit more in terms of sort of how 10th Ave got involved in health and human services.
Mm.
For us, that is it's a very rapidly growing category within our firm, and I'm interested just to hear kinda what was that entry point for you, and tell us the story in terms of your journey with health and human services.
Health and Human Services was yeah, it was a huge thing for us. It started about 4 years ago, and we had been working with a well, let's just go back here. Many of us that are in this space, one of the best compliments we can get is a referral. And so what's great is when an organization that you've worked with or someone refers you to someone else. And so honestly, it came through that. And I don't think that's coincidence. I think that shows how our firm, and this is similar with Belmar, eh, success is counted also by those who share who you are. And so we had organization from an unrelated organization that shared our information with a health and human services um, organization in the Bay Area in California, and we started supporting them on Salesforce, just offering Salesforce administrative support to a team that we really didn't have any background in the health and human services space before, but we knew Salesforce. Um, and what we quickly realized was this organization not only needed Salesforce support, they needed some organizational uh, they need to bring organizational efficiencies, and they needed actually some consulting as an organization, not just Salesforce. And I think if I can pause here, one of the key things, I don't care if it's health and human services, fundraising, wherever, in order to implement Salesforce well, we have to look beyond Salesforce when it comes to consulting. It has to be holistically, what does the organization need? And the best Salesforce consultants are ones that know Salesforce and can also have an operational mindset, a process mindset, can think well about how people work and how things are efficient outside of Salesforce. One of the things I always said, let's look at how it would be done on paper before we figure out how we do it technically. Because if we don't totally understand the process, we're not going to get it. So that's what made us successful in a space we hadn't been in before. So we were given the opportunity to come in and offer Salesforce support to this organization and quickly gained their trust to speak into their operational practices. And in doing so, we continued to gain support to where we started their project to bring on what's called the CalAIM initiatives. And this is the California Advancing of Medicaid program that they had. And that started in 2022. And this organization wanted to participate in that. But there was a laundry list of technical requirements and reports and all these kind of things that came along with it. And because of our relationship with them, we were the ones chosen to help bring them into that program. And so we worked with the payers and we worked with all of the state's requirements and learned all of it ourselves in order to support and serve this one client. And we got to the end of that, and that was a very large engagement. And we got to the end of it, and both 10th Avenue and this client had a mutual desire to see this shared with other organizations. This particular client could afford the investment into the technology, and there were some grants and things like that. But when we looked at this, we said, how do we allow this same um, technology and what we've learned to be passed on to other organizations that are a half or a quarter their size that couldn't afford to do this on their own? And so that really set us on a mission to figure that out, because just like I'd said from our start in the fundraising world as a client, I wanted to see how we could change the industry and do something different. So Scott, in the same way, I had that motivation again when we were working with this client to say, how can we change the consulting industry as it relates to the health and human services space? Um, there's a lot of these small community-based organizations, CBOs and nonprofits that are really trying to serve people in need. And one of their biggest limitations to either access funding or to meet some of these healthcare requirements that are out there now is their technology. And so we had to help them figure that out. And it was really good. It was a really good process. It happened over a number of years. And as we'll talk about, I mean, that's the exciting part of this merger. What has now become what we call Care Ready, that now is part of the Belmar team, is that was the beginnings of it.
Yeah. Well, it's really it's cool to hear how that journey started, germinated, started to grow, and then it's grown into something, much larger than I'm sure you ever thought it would. And it reminds me actually of, even our journey into nonprofit. We were working in public sector and other areas, and we just, it was kind of that first opportunity. We got in with an organization. We, honestly didn't even really perceive them to be a nonprofit. And they, one thing kind of led to another through relationships. And before you know it, a few years go by, and it's the largest percentage of business that we're doing. And I think there's like, it's both, there's these opportunities that come up, but there's also then just like it'll only scale if there's proper execution. And I think you called it out well, that if you start on paper uh, and then move to technology. At the end of the day, Salesforce is, in our view, the best tool to do these things. There other tools, yes, and with the right consultants, you could probably go and accomplish most of your goals. You can certainly, from my perspective, accomplish all of them from using a Salesforce-based tool. But it's cool to hear that. So, Matt, you've Matt Hui, that is, you have got more insight into Care Ready. It's probably a good segue to jump into
Mhm.
that. So, what I guess what's got you excited about Care Ready, and just what it's doing for these organizations that Matt's been working with, but that we've also been working with, and as we look forward, that we're working on together.
Yeah. Well, I think it's helpful to even just wind back a bit. Scott, you said proper execution, and I think proper execution is it takes many forms. And part of what I'm so excited about this event occurring is that Care Ready, which was a package that Matt Reed and team had built out to really serve the needs of these health and human service organizations, takes a bit of a different approach here, and it goes back to proper execution. Sometimes the right path is, let's understand everything, let's develop and capture all these requirements, let's design a solution, and let's go and execute against that. That's great, and that may work most of the time, but in many other cases, an organization in this HHS, health and human service space, may not know where to start. They may not know what to ask. It's kind of that saying, you don't know what you don't know. That could not be more true. Sometimes you don't even know where to start. So where Care Ready starts is you're starting from a pre-built package that is based off of best practice, based off of what we've seen other organizations do already, and you're starting with a truly prescriptive approach in that let's get you in the system live, and then let's unwind or add in pieces that may or may not make sense And it really makes a big difference when you've got an organization who has no programmatic experience or program process, starting from well, this is what everybody else does, so that they can fill these, be it CalAIM requirements, these requirements that these payers are asking for, these health plans are asking for as well. So it takes a bit of a different approach. And I've heard this time and time again, that the time to value, I think that can materialize a lot of different ways. Some people may say, let's get you fast time to value or speed to value, but being able to have something up and running that you can go live with in a span of 6 to 8 weeks is not something that I've seen before, not to a high degree of success that Matt Reed and team have built out. So that's the part that I'm really excited about, is when it all rolls back to proper execution, but also value, and that values alignment. It's how do you deliver value without having to take the same door every single time. So it's a very viable option to get them live, ready to go in a very short period of time. So
And I
Matt
think
Reed,
that's interesting that you say that about value because, a lot of times in this industry, when I think we hear the word value, it's all about finances. And that's not true. I think one of the things we have to consider when we look at value is what you are able to do in the whole process. Yes, are finances part of that? Of course they are. But what's valuable about the process that we have put in place with Care Ready is not just the time to execution, but how we guide someone and how we guide an organization into utilizing that platform. And as Matt just described, we're helping them get going in 6 to 8 weeks, but not with a false assumption that this is all they will ever need. But it's a foundation to actually use the system and get started very quickly. And when we're in the health and human services space, whether it be the California initiatives or other states are adopting these same things, where Medicaid and other insurance companies are actually able to pay for these other non-clinical services that will ultimately lower healthcare costs. And that's the industry that we're serving in this HHS space. And so value comes from an organization's opportunity to adopt the whole process at a speed they can go at. And so one of the key things has been we get started in 6 to 8 weeks, but one of the very important elements to this is another 6 months of ongoing support that's required. That's part of the process. That not only is it support to help someone adopt and learn the system, but it's almost like a small iteration, a 1.1 or 1.2 on the other side, because until a program manager has been in the system for 2 or 3 months, they can't make the right decision. And in the typical consulting world, this is a whole nother phase 2 project on the other side to make these changes. And so they get this, um, they start out on a system that they don't like. They're like, we already want to make changes day one. And instead of saying, well, let's wait and do another project or a phase 2 and list all your changes and requirements, with the model we have, the value we're bringing is to sit down with someone every other week and say, what have you learned about your organization and using the tool? And how can we adjust this week to help you get more value out of it? That's not something that typically happens in this space. And so I think that's a key thing, is to realize not only are we bringing a better financial offering, but I think the value primarily comes from the approach.
mhm. Yeah, and Matt, we referenced the 6 months of mandatory support. I mean, the reality is, if anybody's telling you you're going to have a system 100% ready to go with
Yeah.
zero customization, I mean, I've just not seen it be done that way. And the reality is, sometimes clients may share that, but we've seen time and time again that you don't know what you don't know, like I said before, until you've been using the system. And what you get at the end of that 6 months is you now have an organization who is based in the system, high adoption, but also, if they want to work with you post that, they want to work with you because they want to, not because they feel forced to work with you. And that's some of the value testament to why you've got organizations that had partnered with 10th Ave and yourself for 7, 8 years as well. So it kind of goes back to that value chain of value doesn't always, like you said, mean just dollars and cents. And while it is a very attractive and reasonable price point. I think, in my view, you need to spend some money so that you have some conviction as to this is going to be this is an investment here. But at the same time, you can't be breaking the bank to get to something to be usable as well. So it's kind of that
Absolutely.
perfect blend there.
And I want to kind of turn that question back to the two of you as well, of when we share many of the same values going into this. And I know you guys have a desire to see, really, to build on some of the things that you've learned over the years, adopt some of the things we've done. I'm curious to hear what you want to see changed in the consulting industry, and maybe since we're talking about the health and human services space, what is it that you're excited about being able to bring to the whole of the space now with this acquisition? And just even without us, what was it that you were excited about in this next season as it relates to this sector?
Yeah,
Matt, why don't I tackle that first, and then
sure.
you can answer.
I get it. I'm talking too much, Scott. I get
No,
it.
not at all. I think I'm just you've given your vocal cords a rest here. But yeah, Matt, it's an interesting question in terms of like what do we want to see change. So I think let's start with what's the problem. I mean, we see this so often is it's blame can be laid in different camps. So we've got a customer that sometimes approaches a conversation with an unrealistic set of expectations, and they're talking to multiple parties, multiple firms like ours that are effectively bidding on this work, but they've got deaf ears. They don't want to really hear, uh, I guess, the truth, and they make a decision that leads them down a path that just is not ideal. Number two is we have on our side, we sometimes just misunderstand their requirements, and it's the analogy we often will use is that of building a house. If I came to a builder and said, "Hey, I want to build this house," but I didn't have a set of drawings already done. I mean, I can verbally articulate. Maybe I can share some documents with a description of what I would like, but it's very difficult in a short period of time to accurately understand what their needs are and be able to provide them with uh, a, a, a- an accurate estimate that's going to actually deliver on all of the things that they think they need. And then the third is we have this partner in Salesforce that them like us, like in many cases our customers too. Everybody's dealing with timelines that are shorter than they maybe should be, and we're trying to get a project or a deal across the line, and a customer's trying to make a decision because they've got money that they need to spend by a certain date. So there's all of these incentives or motivations that creep in that really don't always allow for the best experience. So what I'm excited about is, at least with Care Ready, is it this is a package, and the price point is appropriate. It's it's a solution in a box, but it's not the perfect solution. But what that customer is having to agree to is that it's not perfect on day one, but it will move in the direction of perfect over a time horizon of 6 to 12 months. And that's just a very different way of thinking about delivering a project. And it's so to me that's exciting because we as an organization historically have been very project based, and in a lot of cases that was the right way to do it. But this is a different way of doing it that uh, creates more time horizon for that customer to find success. And your introduction where you described being on the client side and being delivered a solution that didn't align or didn't meet the expectations, uh, that's ultimately what led you into this world. I mean, unfortunately, that happens more often than we'd like to see happen in the industry, and so I see this as just a way that we can collectively avoid that and allow a customer to really be set up for success. So Matt.
Yeah, I guess my turn to chime. Where do we see this going? I think Care Ready offers a, like Scott was saying, a good starting point. But there are three things I jotted these down as you were chatting, Scott. Three things in terms of direction. Number one, what I've seen in this health and human services space is uh, everybody's trying to do there's a lot of commonality, but everybody's trying to do it a little bit differently. And I think the reality is health plans, um, uh, health organizations, the rules in which have to be followed are always changing. The baseline's always changing. So I think that there's opportunity with the Care Ready package to create a community of like-minded individuals to help crowdsource that feedback to make this package even better. So that's number one. The reality is, while nonprofits may look and feel the same, they're all doing something slightly differently. So creating some ability to, outside of the technology, create relationships and create connections to almost have an advisory, if you will, advisory group or working group. So number one is community, create community. Number two, with more people being able to entertain the idea of what Salesforce is. It's a premium product with more people able to implement at a very affordable and reasonable price point. I think you just get more organizations, get more reps, more people to give feedback to improve the package. Um, improve the package, which I look at as ease of installation, ease of implementation, ease of ongoing support as well. And I think it's those two tied together, the ongoing maintenance but enhancement of the product and package, and incorporating things that Salesforce is also working on. I think the beauty of it is that it is not a custom built solution. It leverages a lot of very out of the box pieces and repeatable pieces that are declarative, things that
Mhm.
can be managed, and being able to leverage Salesforce's big focus on even things like AI and Agentforce in the future. Like that is the future here. Being able to keep this at a very affordable price point and only add more value to the package, I think is really interesting as well. So community insight, create this kind of working group consortium concept with like-minded HHS organizations, and also improve the packaging and pack more value into this package while not straying away from the configuration and declarative first approach. That is what Salesforce, and that is something that we believe in as well, the configuration declarative first approach.
Yeah, that's an interesting one too, because that's what attracted me to Belmar as well, and where some of that alignment came is because when we look at what others are doing in the industry, there's a lot of things we can do these days with Apex code, and I'm grateful for it. I'm grateful Salesforce allows us as system integrators and as consultants to have access to code-based things and 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 that's good for these complex solutions. But there's another hand of some of the organizations that we'll work with simply don't have the funds to support a custom built coded solution long term. And what we are bringing to the table with Care Ready is something that is 100% declarative. And that allows a system administrator at the client's organization or just any other system administrator as part of the Belmar team. Like everybody can easily jump in because this is declarative and not custom code. And I think what we've seen in the industry is this automatic assumption that we have to do things with Apex because it just seems complex, but yet what we've done is taken what has been complex and accomplished it declaratively, and then we give people the ability to actually keep it updated and up and going. And I think this is another one of those value things, Matt, that it's appropriate to talk about because one of the things Care Ready's bringing to the table is not just the ability to work in the health and human services space, but part of what is happening across the industry is there's all these inputs and outputs that have to come as part of this. And what we're bringing to the table is having all those pre-configured. And so, then this is why that product, as you mentioned, Matt, from a crowdsourcing and like just a community building it and contributing as a client needs a new payer brought into the system, we're going to be able to do that. And then it's available for others as well. And so, what we don't see anywhere in the industry at the moment is a product that comes to the table with a health plan's reports and inputs and outputs and all these things pre-configured in it, but Care Ready does. And when it doesn't fit, that's what we're going to go develop and bring in as part of the package. And so that's a unique place where um, just so uniquely positioned at the moment in
Mhm.
the marketplace. And that going back to those how we implement, most consulting firms right now are coming and asking the client, well, show me what your inputs and outputs are. And we're coming to the table actually telling the client when they share that they're going to work with a particular health plan. Most of the time, we already know what that input and output is better than they do. And so that's another way that as we look at this package and we look at how it works, I think is going to transform and change how we look at things. And this requires you guys to change the way Belmar thinks a bit, because this takes you out of just being a Salesforce firm and actually puts you in a role of being the data experts in some of these cases. And so it does expand what you're doing. And I guess I just maybe I'll pass it back, maybe Matt, over to you of just addressing that. But this is a unique opportunity where Belmar is now going to be seen as the experts when it comes to data and connection with these different payers. What's that going to be like for Belmar, and what kind of changes that for you guys?
Yeah, I mean, I don't think it's actually that big of a change because to be the go-to expert, and I always look at the value proposition of a consultant as how can you understand a client organization or a client's business process better than they can? And I think the highest compliment you can get is when you get to the end of a project and one of the folks that works at that organization says, "You actually know more about this than I do.
Yeah.
Like we could bring you in here."
Yeah.
And I think that level of understanding that is shared across being that trusted advisor. To get there, you have to understand beyond the technology. You have to understand the landscape. So pick health and human services, pick fundraising as an example. I mean, even just something as niche or ever changing as something like tax receipting. And that has its own nuances and that changes as well with compliance standards. Like understanding that, that's something that we've had to pick up and understand over the years to be a trusted advisor. So when it comes to health and human services, I look at it as, yes, it's a net new or a new space that we've not gone as deep in, but we're starting to get deep and to be a trusted advisor, part of this Care Ready package and part of just that learning process and getting and staying sharp is understanding pieces outside of the technology. So not altogether too different than
Yeah,
what's
and I
being
think you're
done in the
you're
past.
right. Now that you speak it like that, I think that is one of the things that is so aligned within our organizations. And yes, it is a new place. It is kind of a new method of curating that information. Uh, but we've seen Belmar as one of those consulting firms that just values that very highly. And again, it's one of the alignment points between 10th Avenue and Belmar.
Yeah. Yeah, which I'm really excited about. And I think one last point, and then maybe Scott, I'll pass the baton back to you. But um, I think it's around knowledge sharing as well. Being able to, if you go at it alone, I mean, we've all heard that saying, if you want to go far, do all that kind. I'm not even gonna try to butcher that phrase, but nonetheless, if you go and just try to learn this stuff all by yourself, you're gonna hit a cap. There's a cap of how quickly you can learn, and the reality is the landscape always changes, especially with health plan information, especially with the standards, especially with CalAIM as a whole. The ground is changing. If you go at it alone, you will only get so far. But when you have a mindset and a cultural mindset of how can we share information, and this goes down to can you have a conversation with somebody and be a sounding board to that individual? Can you share what you've learned culturally? If that is woven into your fabric as an organization, you can just go that much further. And then you can have everybody have that baseline of we are all trusted advisors and let's pick each other up. Let's edify one another versus let me silo, let me hold this knowledge and you only come to me. I'm the person that's gatekeeping this knowledge. So when you break down that from a cultural standpoint, I think that's where you can really go far as well. But Scott, maybe
Yeah.
Cognizant, we don't have unlimited time here.
No. Unfortunately, we say that to our clients. We don't have unlimited time or budget, so we need to be efficient. And so, in that vein, I think this has been a great introduction to yourself, Matt, to this amazing product that you've brought to market, and we're excited to take it further and work together to continue to build on this foundation that you've laid, and build the community. And so with that, we'll bring this podcast to an end. If you want to learn more about anything we've talked about, you can reach out to us through our website, and we will reach back and set up a call to have a discussion. And so, Matt Reed, thanks for doing this.
Thanks so
Appreciate
much.
the partnership over the last 8 months, and we're excited about where we're headed. And we'll do another one of these soon.
Let's do it.
After
Yeah.
a few months of this integration completed, we'll do another one of these, and we'll see what our latest ideas are. But with that, we will wrap, and thanks everybody for listening. And Matt Reed, Matt Hui, thanks for doing this.
Thanks, gentlemen.
This has been another episode of Belmar Bites, brought to you by Belmar Consulting. You can follow us on Apple, Spotify, YouTube, or on our website at belmarcloud.com.